Assalamu alaikum. Welcome back to Dr. Tariq RYK. Today our topic is about the bones of the wrist or bones of the hand. So there are 8 carpal bones, 5 metacarpal and the 14 phalanges. We will learn each and every bone of the wrist, 8 carpal and 5 metacarpal and the 14 phalanges, their features, their clinical landmarks and their articulation and their arrangement. So let's start with the carpal bones. There are 8 carpal bones. These 8 carpal bones are arranged in the 2 rows, upper row and the lower row. Upper row known as the proximal row and the lower row known as the distal row. Each row consists of 4 bones. Upper row consists of 4 bones: sacrified, lunate, tracheotomy and pisiform. This arrangement is from lateral to medial, from thumb side to little fingers, and the second row or distal row consists of also 4 bones. First one is the trapezium, second trapezoid, third capitate and fourth one is the hamate. So these are the 8 carpal bones. So let's start with sacrified. Sacrified is from the proximal row. This is the sacrified bone. This is the large bone of the proximal row. It consists of the tubercle of the sacrified. Sacrified articulate proximally with the articular surface of the radius and distally with the trapezium and also with the trapezoid and with capitate. This is the sacrified. If we see from anterior view, this is sacrified. If see from posterior view, sacrified will be like this, and from lateral side we will see like this, and from medial side this is the medial view of the sacrified. And if you see from the superior view, sacrified will be like this, and from inferior view we will note like this. So this is the sacrified bone. Now we will see lunate. Lunate is the second bone of the proximal row. This is the lunate. This is the moon-like. You can see this is very small moon-like bone. This is very small bone. This is second to sacrified. This is also connected with the radial surface of the radioulnar joint, distal radioulnar joint. This is also connected with the radioulnar joint. This is very small bones. Anterior view, this is anterior of the lunate. A posteriorly like this, laterally this will be like this, and from medially we will see like this. If we see from superior or upper side, it will be like this, and from inferior view lunate will be like this. This is the anterior view. Now we will see the third bone of the proximal row is tracheotomy. This is the tracheotomy. This is tracheotomy. This is also very small bone. This is most lateral, most medial side, present on finger side and medial side. This is 3-cornered bone. You can note 3 corner of the bone. This is from here and third one is here. This is triangular bone. This is also very small bone on most medial side of the rest. Now we will see the very small bone of the proximal row. This is pisiform bone. This is very small. This is the sesamoid bone. It is P-shaped like. It is very small P-shaped like bone. It is joined with the tracheotomy inferiorly. Anteriorly we will see like this. Posteriorly will be like this, and lateral view will be like this, and from medial we will see it like this, and its superior view is and from inferior view it will be like this. And now we will see the distal row. This is the trapezium. This is trapezium. It has a very large tubercle. This is the tubercle of the trapezium. Superiorly or proximally it joined with the sacrified bone of the proximal row, and medially it joined with the trapezoid, and inferiorly it joined with the metacarpal bone of the thumb. If we see from anteriorly, sacrified will be like trapezium will be like this. Trapezium will be like this, and posteriorly it look like this, and lateral view we will note like this, and if you see medially it will be like this, and from superior view it will be like this, and inferior view it is like this. So this is the trapezium, and it has a large tubercle. Now we will see the second bone of the distal row. This is trapezoid. This is very small bone. This is wedge shaped bones of the distal row of the wrist or carpal. This is very small bones. Anteriorly it is like this, posteriorly lateral view, medial view, superior view, and then inferior view. This is the wedge shaped bone known as the trapezoid, and it is present in the second row and second position. It joined with the second metacarpal, or also known as the shahadat finger. Now the third bone, this is the large bone of the carpal, capitate bone. This is capitate bone. You can see this is head like. Capit mean head. This is head like bones. Anteriorly it will look like this, posteriorly, and then laterally. Now it is medially, and from superior view and inferior view it will be like this. Capitate proximally joined with the trapezium, and it is laterally trapezoid, and medially with the hamate, and superiorly with the lunate. Superior it is joined with the lunate, and laterally with the trapezoid, and also with the sacrified, and medially it is joined with the hamate, and inferiorly it is joined with the third finger or capital finger, third metacarpal, and also with the second metacarpal. So this is the capitate. Now we will see the last bone of the carpal, known as the hamate bone. This is hamate bone. This is hook like bone. It also have a hook. Now this is hook. This is the hook of the hamate. This is hook like. This is for the articulation of the muscle ligaments. This is the hook of the hamate. If you see from interior view, hamate will be like this: posteriorly, laterally, medially, and then superiorly, and finally will be inferior like this. This is the hamate bone. It we can note it has a hook like structure, hook like protrusion or tubercle, known as the hook of the hamate. So this is the hamate. Hamate superiorly joined with the trachea, and also with the lunate, medially with the capitate, laterally with the capitate, and medially with the fourth and the fifth metacarpal bones. Inferiorly will be the with fourth and the fifth metacarpal. So this is the hamate bone. It is hook-like bone. Now we will see the metacarpal. We remember there are 8 carpal bones in 2 rows: proximal, distal, proximal from lateral to medial, sacrified, then lunate, then tracheotomy, and small sesamoid bone known as the pisiform. And from the distal row, from lateral to medial, trapezium, and then trapezoid, capitate, and then the hamate. These are the 8 carpal bones, and also known as the wrist bones. Now we start from the finger bone, are also known as the metacarpal bones. There are five metacarpal bones. If we start from lateral, first known as the thumb bone, second is the shahadat bones, and third is known as the capital bone, and fourth is the ring bone, and the fifth one is the little bone. These are the 5 metacarpal bones and their common names. Let's start from the first or thumb metacarpal. This is the first metacarpal or thumb metacarpal. This is large bone like. This is large bone. It has two end parts and with the base, head with head, shaft and base. It has 3 parts: head, proximally, medially, shaft, and distally is base. It has 3 parts. Anteriorly it look like this, posteriorly, laterally, medially, superiorly, and inferiorly. This is the first or thumb metacarpal. Proximally it joined with the trapezium and distally with the proximal phalanx. Only thumb has 2 phalanges, but every finger has 3 phalanges. Only thumb has proximal and distal 2 phalanges, but other has 3: proximal, medial, and the proximal, middle, and the distal. 3: proximal, middle, and the distal. Now second is the second metacarpal, or also known as the shahadat bone. This is the large bone. Also it has a head, shaft, and then base. It also has 3 parts. Anteriorly it look like this, posteriorly, and then laterally, medially, superiorly, and then inferiorly. This is the second metacarpal. Now we will see the third or capital metacarpal. This is the third one. This is the most capital from other 4. It is anterior view, this is posterior, this is lateral view, then medial view, this is the superior view, and then inferior view. This is all about the third metacarpal or capital metacarpal. And now we will discuss the fourth metacarpal or ring finger. This is the ring finger separately. Anteriorly it look like this, posteriorly and laterally, medially, superior view, and then inferior view finally. It also has 3 parts: superior or proximal head, medial shaft, and the distal part is known as the base. It has also 3 parts. Now we will discuss the last and fifth finger. It also known as the little finger. This is the little finger. we will note the three parts of the little finger. This is the base, this is the shaft, and this is the head. It has three parts: base, shaft, and head. This is the head, distally, medially shaft, and proximally its base. This is very small, a little. It is also known as the little finger. Now we will discuss about the phalanges. There are 14 phalanges, as we know already. As we know, thumb has two phalanges. This is proximal phalanx of the thumb, and this is the distal. And now we will discuss every phalange, and then we will discuss the its features. Take this one, proximal phalanx of the thumb. This is the proximal phalanx of the thumb. It also has three parts. This is the base, shaft, and then finally head. So this is all about the bones of the wrist or bones of the hand. As we know, we will revise now again. There are 8 carpal bones. They are arranged with the two rows, proximal and distal rows. Proximal from lateral to medial, proximal rows. First one is sacrified, then second is the lunate, then trachea, and a small piece of a bone is known as the pisiform. And then second row are the distal row. From lateral to medial, first one is the trapezium, then is the trapezoid, then capitate, then the hamate. These are the 8 bones of the carpal bones. Then there are 5 metacarpal bones, also known as the finger bones. The 8th upper are carpal bones known as the wrist bones, and other 5 bones are known as the metacarpal, are also known as the finger bones. There are 5 finger and have 5 metacarpals, and each metacarpal has 3 phalanges, but only the thumb has 2, proximal and the distal. Each metacarpal has head, base, and the shaft, and each have the same features. These are the all about hand bones. This is the anterior view of the hand. This is posterior view of the hand. This is lateral view. This is the medial view, superior view of the hand, and then the inferior view of the hand. So we have revised all about the hand and the all bones of the hand. We will revise the joint between the carpal and the carpal joint, and joint between the carpal and metacarpal and the carpo-metacarpal joint, and then joint between the metacarpal and the phalanges known as the metacarpophalangeal joint, and other joints between the phalanges known as the phalangeal joints. So this is all about the arthology or the skeleton of the hand. So this topic is ended, and if you have any question, if any confusion, you may comment. See you for next. Allah Hafiz.